Hi everyone, my name is Jana Houghton. I have a case study on Endograft-stents. My case study is really not a case study due to St. Mark's, where I'm at with my clinicals, do not offer vascular. So I'm just going to go over what an endograft stent is. It is a graft that is minimally invasive that helps treat aortic aneurysms. Instead of opening up the chest and repairing it with an open chest, they can just go right through your groin up into your aorta and just fix it from there. It is a fabric-covered cylinder that expands with some wire meshing on the outside. It's also known as a TAVR or an EVAR. So an endograft, like I said, is a hollow fabric-covered tube surrounded with a mesh cylinder/stent. It's permanently placed into the aorta. It reduces the pressure on the aorta, allowing blood to pass through it without pushing on the weakening or bulging artery. So when do you use an endograft? You use an endograft when you have a balloon portion of your aorta. If left untreated, the aorta could rupture, causing a massive internal bleeding. The endografts are used to fix the weakening portion of the aorta. The goal of the TAVR TEVAR is to reduce the risk of complications from the aneurysm. The major risks of untreated aneurysms are ruptures, and the aneurysm can get bigger with a greater risk. So the tube goes in and it expands and makes a flawless motion of blood that can just pass through without pushing on that weakened wall. Here are some diagnostic imaging that if you suspect that you have an aortic dissection, they will go through. If you're unstable, they'll go more towards a TEE. If you're a stable patient, they will do a CTA, TEE, or even an MRI, and they'll just follow the flow chart from there. Endovascular grafting is performed. There's several factors considered when deciding to treat a patient with an aneurysm with surgery, including the presence of symptoms, including abdominal pain, back pain, or pain in the groin or inner thigh. The size of the aneurysm is particular, its diameter, how fast the aneurysm is growing. If it grows faster than larger than 1 centimeter a year, it's growing pretty fast. The development of an aortic dissection. This is a sudden, you'll feel like sharp tearing pain all the way down your chest and back. The patient's overall medical condition. Your doctor may consider your specific condition and needs to choose what's the best treatment for you. I placed a video here to show you what an endograft placement looks like. I would recommend it. It's about 3 minutes long, and it gives you a brief detail of what happens. Patients that may need an endograft, family histories might include aortic aneurysms, Marfan disease, connective tissue disease, or bicuspid aorta. Your doctor will recommend regular ultrasounds, CTs, and MRIs to examine or screen for aortic aneurysms. When to see a doctor or even call 911. Most people with aortic aneurysms do not have any symptoms unless it dissects or even rupture. A rupture or dissection is a medical emergency, so please call 911 or head to your local emergency room immediately. If your aneurysm ruptures or more than one layer of your artery wall splits or causes dissect, you will feel a sharp, sudden pain in your upper back that radiates downwards, pain in your chest, jaw, arms, and even neck with difficulty breathing. Aortic aneurysms grow slowly and usually without symptoms, making it difficult to detect them. Some aneurysms will never rupture. Many will start small and stay small. Although many expand over time, how quickly they expand and grow is difficult to predict. A thoracic aortic aneurysm grows. Some people might notice they have tenderness or chest pain, back pain, hoarseness, cough, or shortness of breath. There's different types of aneurysms, and aneurysms is a breakdown of your vessel wall. The connective tissue starts to degenerate, and it increases the weakness of the wall. With the aneurysms, there's several different types. There's true aneurysm, falciform, succular, and if your aneurysm dilation of the vessel wall is at least 1.5 times the normal diameter, then you're considered to have an aneurysm. I put a picture there that you can zoom in on that shows you the different types. Here is a normal aortic valve in a peristernal long view of the heart. And you can see here's the mitral and here's the aortic, and woo, right there is the aneurysm. And once again, peristernal long 2D echo, mitral valve, left ventricle, aortic valve, and then a huge dilation of the aorta. Marfan's disease is one of the family history traits. It's a genetic disorder that affects the connective tissue. These are a list of the different connective tissue disorders that are related to having aneurysms and needing Endograft-stents. Bicuspid aortic valve. So you can see here, this is a tri-leaflet valve. This is your aorta. That sits open, and when it closes, it looks like a Mercedes-Benz sign. Bicuspid aortic looks like a fish mouth, and it's only 2 leaflets. Where does this procedure perform? It is performed in a cath lab or interventional radiology suite. Recovery: right after surgery, you'll probably feel tired. Your doctor may require you to lay flat for 4 to 6 hours. The legs wounds begin to heal. The patient might report some discomfort from where the stent and grafting procedure was done. You might experience some swelling, numbness in your legs, nausea, vomiting, and you may be expected to stay in the hospital for a few hours up to a few days. It depends on how well you went through surgery. After you leave the hospital, your doctor will give you detailed instructions like don't smoke, eat a low-fat diet, low cholesterol, daily exercise, do not drive until it's okay, avoid taking baths until your wound is healed, no lifting heavy weights until you get the go-ahead. And then there's a follow-up appointments that are 1 month, 6 months, and a year. And I wasn't able to find some images of the graft through ultrasound. It's very light and it just looks a little bit like a brighter surrounding. So I found that these images actually show the graft a lot better. You can see here's the graft here. And then here's the placement of the graft, and you can see it right here in the aorta. Very nice. And then here's another view. So I hope this helped you out on what an endograft/stent is. If you have any questions, please feel free to email me. It is in our PowerPoint for our abdominal vascular review, and it's under notes. So if you have any questions, don't hesitate to call or email me through Canvas. And these are the references that I have for my PowerPoint. Thank you, and I hope you enjoyed it. Have a good day.